Good morning, guys. We're all sparkly. It's safe to say when you approach the NHS with testosterone deficiency, it's a struggle to get treatment. If you're lucky enough to be prescribed testosterone replacement therapy, it's going to be a cookie cutter approach. That means either the gel, now we know the gel is unbound, so it rubs the lotion on its skin, then it gets metabolized. The half-life of testosterone is very short, so it just gets excreted out. So you might get a little bit of a peak and a bit of a dopamine hit, but for true stability, Testogel is not effective, especially when administered once daily. If your doctor is amenable, I would suggest asking him if you could apply it twice daily to at least try and achieve stability. Now, the other options under the NHS include Nebido, that 12-weekly 1,000 milligram injection that goes to the liver, gets slowly cleaved, releasing the testosterone to produce stable levels. No, can't do, can it really? So, how do we prescribe Nebido at the Men's Health Clinic? Well, rarely. We did when we started the clinic, because obviously we followed the guidelines and the manufacturer recommendations, and we believed that acting in the best interest of the patient meant prescribing as per the manufacturer guidelines, because obviously all the studies suggested it was an effective methodology. But practice, no, not quite so good. Obviously it all reached to pre-treatment levels and subsequent ineffective qualitative and quantitative markers as a result of obviously what? Not mimicking physiology. So what other options have you got? Well, you've got Sustanon every 3 weeks. 4 esters, doesn't make sense, does it? Enanthate every 2-3 weeks. Again, massive peak, trough. And you're going to get a rise in hematocrit compared to Nebido. Yeah, this awful treatment, Nebido, actually has less adverse outcomes than injecting something that we use sometimes, but not in the same way. Because again, if you understand pharmacokinetics and pharmacodynamics, you'll understand you don't want a big peak and trough, because the premise behind TRT is what? Yeah, mimicking physiology. Day, night, day, night, day, night. So you want stable male androgen levels for long-term physical health, and you don't get that from a massive peak and a massive trough. And again, what's the NHS trying to do? It's about disease prevention. It's not about health optimization. They want you in, they want you out. Bless them, they've only got 10 minutes. There's no chance that you're going to get stable, optimized levels from an NHS protocol. You might feel okay, and good on you if you do, because we know that TRT protocols under the NHS are not going to cause adverse outcomes from the perspective that we know that they are safe, but they're not particularly effective. Now you're going to go then to look for answers on the internet, and you're going to see all sorts of nonsense on the internet. You're going to latch on to somebody. Perhaps you've latched on to me. Perhaps because it's common sense, logical, and I'll give you a perspective that you're not going to get from anybody else. TRT is going to make you superhuman. TRT is going to give you a foundation to make yourself you, but not superhuman unless you are superhuman. And nobody's superhuman. So you'll go on to other channels and go, well, this doctor said this, this doctor said, I don't care what that doctor said. Literally no interest. So I was told that TRT is trial and error by a TRT expert. He said, you know, we'll try this, we'll try that, see what works for the patient. Now that sounds good, doesn't it, really? We'll see what works for you. We'll see what you want to do, and we'll work with you to make sure you feel great. That's adopting more of a sales-consumer relationship, because lots of patients say to me, what would you do if you were me? That's rung true throughout my whole career as a surgeon, as a GP, and now obviously as a TRT doctor, with over 3,500 patients from 50 plus different countries, all trusting our methodology, all trusting me, because it's tough love, it's truth, it's realism. I ain't going to sugarcoat anything. I'm going to tell you what you can do to positively impact your health and well-being. And it's going to take what? Effort. So yeah, trial and error. We'll try you on the gel. We'll try you on the cream. We'll try you on the injections. For the love of God, if you understand physiology, pharmacokinetics, pharmacodynamics, all the ologies and the wologies, you'll understand that microdosing is going to be the most effective way of achieving stable male androgen levels for you to feel good. Now, is it all about feeling good? Oh, if only it was. But it's not, is it? Because as I've said before, we don't want a drug effect. We want a true effect. We want to wake up and feel motivated, but we want to do it. We don't want that spike of dopamine as a result of testosterone, because obviously if you have a less intensive injection frequency, you're going to get a peak and a trough. That peak feels good. The trough doesn't feel good. Highs and lows, baby. But we want highs and lows on a daily basis, because that is what happens in nature. Anabolic processes predominate at nighttime. Catabolic processes predominate in the daytime. So we want to mimic physiology with a daily injection in the morning of TRT and HCG. That is the most effective way of achieving healthy male androgen levels. So trial and error. Are you really going to a doctor that's going to suggest that it's trial and error? That seems utterly absurd. You might as well get it from the bros, because that is trial and error. What you want to do is place your trust in somebody that will act in your best interests. Always. Not lead you down the path of too good to be true. Not lead you down the path of, well, it's all about how they feel. It is, and it isn't, because it's also about safety. It's all about making sure that testosterone is healthy to allow for normal physiology. It really is quite simple. Now, this bozo of a doctor was saying, yeah, well, we see more of a rise in hematocrit with cypionate compared to creams. I think it must be something in the solution, the excipient. No, it's pharmacokinetics. If you're not prescribing daily, you're going to get a big Cmax, and that's going to stimulate erythropoiesis. So the kidneys are going to release EPO to tell the bone marrow to produce red blood cells, and you're going to see a spike. Really? It's quite embarrassing that TRT is considered trial and error. Now, it's not done very well by a lot of people. And the evolution of practice at the Men's Health Clinic has been, as per manufacturer, to then look into the American model, to then adapting our methodology to act in the best interest of you, to think, actually, yes, nature, we want to mimic nature. Yeah. It's not rocket science, is it? But it takes effort. One of my patients came in the other day and goes, it just gets better and better. I said, what does? TRT does. Because it has a cascade effect. As we've said before, if you've got the foundation, you're the one that can build upon that. Stepping stones. The journey of 1,000 miles starts with a single step. Testosterone replacement therapy can be that platform for you to take that step. Only go on TRT if you clinically need TRT. Approach a doctor-led clinic that will have your best interests at heart, that doesn't offer discounts. I know we all like discounts, But your clinic should be priced according to the level of service and care that you get. And there shouldn't be incentives to go to that clinic, because that's a business, not a medical clinic. So there's nothing else to say apart from what? Yeah, you guessed it. Go earn your reward.